Hi, I'm Dr. Julie Steinauer, and I want to talk with you today about secondary strabismus. Well, what is that? We're going to go into it, but before we do, we want to tell you how you can connect with us. If you're local, go to our, give us a call at 618-288-1489. If you're not local, you can still connect with us. Go to our website at visionforlifeworks.com, and you can do one of two things. You can either fill out a questionnaire or you can schedule a consultation directly with me. Now, secondary strabismus. In this particular case, what I'm talking about is the type of strabismus that develops after a person has had strabismus surgery. So they may have had the surgery to attempt to correct the misalignment of the eye, whether that be in for esotropia, out eye turn, which is exotropia, up, which is hypertropia, down, hypotropia, whatever type of turn it may have been initially. Secondary strabismus occurs after the initial surgical intervention or correction. Now, it can occur for a couple of different reasons. One could be a potential overcorrection or slight undercorrection the first time around. But another reason, which is really where I want to concentrate today, for secondary strabismus developing could be from multiple surgeries and developing scar tissue that forms around the muscles that direct the movements of the eyes. In this particular case, then, secondary strabismus occurs because the scar tissue has kind of pulled the eye into a particular position of misalignment. Well, what can be done about that? Well, sometimes surgery may be necessary in order to try to correct it. But again, you risk run the risk a little bit of causing more scar tissue to form around those muscles. So in cases of what we've seen with our clinic, we work to try to free up the movement of the eye using not only syntonics, which is the photo light therapy, where we're electrically triggering the muscles of the eye to be able to move. There are other things that can be utilized. So lots of eye movements and deep stretches of the eye. But, we'll be honest, that secondary strabismus formed from scar tissue can be kind of difficult to deal with. And so, one of the things that we like to talk about our patients with is kind of a risk management assessment. If you've had multiple surgeries and you've gotten away with not having any problems due to scar tissue, is it warranted to do another surgery? Or maybe should we look at a different route, which is non-surgical as an intervention, correcting and treating the way that the brain is aligning and using the two eyes together, like syntonics and vision therapy. So it's important to look at the risk to benefit ratio as far as if you have had multiple surgeries, maybe there's been 2, maybe there's been 3. The more surgeries an individual has, the more that risk kind of goes up as a potential for scar tissue to develop around those muscles and to cause something like a secondary strabismus that is associated with scar tissue, pulling the eye into a particular position. So it's important to have these discussions not only with the doctor that may be recommending the surgery, maybe the doctor that has sent you to the consult for surgery, but also to be looking at your alternative forms of treatment to say, well, what if you just train the brain to align and use the two eyes together without needing to have surgery to begin with? Is that a possibility? Only an individual who's worked with those types of cases and seen many, many different types of strabismus, many types of strabismus, post-strabismus surgery will really have a good indication or a good clue professionally of how to guide you and what can be expected. If this is you though, maybe you're in the boat of you're not sure if you've got scar tissue, you've had multiple surgeries, or maybe you do know you do have a problem with this, please give us a call. Our phone number is 618-288-1489 if you're local. If you're not local, it's just easier to be able to connect with us online. You can go to our website at visionforlifeworks.com. Due to the volume of patients that we have who contact us every single week, it's important for us to be able to kind of sift through. We don't have time. Honestly, I do not as a doctor. I cannot respond to every single message that we get. So if you kind of go through the process of filling out a questionnaire, or if you schedule a consultation directly with me, then obviously I can answer questions for you. But again, we please like to remind our patients that we do have months that we're fielding and answering questions for 300, 400, 500 different patients who are wanting to utilize our services. And we are very appreciative of that and very blessed, but we can't always answer your questions directly. Sometimes we need to do that a little bit more indirectly, or we need to have you schedule time to be able to talk with us in order to answer your questions more specific to you. Now, if you like this video, hit the like button. If you haven't already, subscribe to our channel, and feel free to pass this video on if you feel it'd be beneficial to someone. Thank you.